Consultancy Associate Professor in Mental Health Nursing. According to Sigmund Freud, we have got three levels of mind, that is the conscious level, unconscious level, and the semi-conscious level. And whatever a person's painful experiences or drives, needs, or wishes which cannot be fulfilled will be stored in the unconscious level of the mind. And at situations when the individual experiences similar scenarios, these unconscious feelings, thoughts, or emotions or painful experiences are going to come to the conscious level, and it's going to disturb the personality or behavior of a person. So we have got a therapy to treat these conditions so that the unconscious conflicts which an individual is having should not interfere with the reality or should not interfere with the conscious level of the person. So the therapy that we have for treating these is called as the psychoanalytical therapy or the psychoanalysis. So today the topic for discussion is the psychoanalytic therapy. Psychoanalytical therapy was developed by Sigmund Freud, which is also called as an insight therapy. It is a very lengthy therapy which requires a lot of time as well as a lot of expenses from the patient end. The aim of the insight therapy is to uncover the unconscious conflicts. So, whatever the unconscious conflicts or desires, painful experience the person had, all those things will be uncovered by the insight therapy. As the name says, insight therapy, insight is nothing but to be aware of about one's own self, right? So here we are making the patient to become aware about his own selves, that is the unconscious conflicts or motives or desire. So we have got various techniques that a psychotherapist will use in the psychoanalytical therapy. So we have got most commonly, which is used the free association as well as the dream analysis. Psychoanalysis attempts to discover the relationship between the unconscious motivations as well as the abnormal behavior. So because of the behavior which an individual is showing or exhibiting which is abnormal, so what is the reason, what is the cause? It can be because of unresolved conflicts which had happened in the life of the person, which is stored in the unconscious level of the mind, okay, or some kind of a motivation which the person had, or a desire or need the person had which he couldn't wish or fulfill, right? So those things which is there in the unconscious level of the mind is disturbing the person and causing the abnormal behavior. So the aim of this psychoanalytical therapy is to discover the relationship, what the relationship between the behavior what a person is exhibiting and what are the unconscious motives or conflicts he had. Sigmund Freud's psychoanalytical theory argues that the human behavior is because of the interaction of three main parts of the personality in an individual, that is the id, ego, and the superego. If these three personality are not able to be managed, okay, then the person may end up with the abnormal behavior. Let us see the assumptions of the insight therapy or the psychoanalytical therapy. To become aware about one's motivation, which helps the individual to change and to make the adaptation very easily. Number two assumption is the cause of the maladaptive behavior can be understood, and the problems or the conflicts which is happening because of these maladjustment can be brought to the awareness of the individual, and it can be modified or it can be rectified. So these are the two main assumptions. Even though the person knows that there is a kind of a maladjustment in him, okay, but he is not able to deal with that. So, through the insight therapy or through the psychoanalytical therapy, an individual will be able to rectify the unresolved conflicts in the unconscious level of the mind. So, that was about the assumptions. Moving on to the goals of the psychoanalytical therapy. The overall goal of the psychoanalytical therapy is to help the individual to deal with those unconscious motivations which direct the behavior in an individual. Only when an individual becomes aware of these unconscious motivations will he be able to choose the behavior which can be accepted to fulfill his life's task. The another important goal of this psychoanalytical therapy is to encourage the individual to express the healthy impulses, strengthen the day to day functioning based on the reality, and to help the individual to perceive the world as a positive place. So, these are the overall goals of the psychoanalytical therapy. Moving on to the therapy process. According to Sigmund Freud, he says the role of a therapist and the patient or the client is explicitly different. So here the patient is termed as an active person wherein he is encouraged or he is the person who is going to explain or express all his thoughts, feelings, emotions freely as it occurs. So here the patient, when he is undergoing the psychoanalytical therapy, he will be in a recumbent position on a couch, okay, so that he will be relaxed, so that he can have a free association or freely express his ideas or the feelings or his dream. The role of a psychoanalyst here is being a shadow person. The role of the therapist here is that he reveals nothing personal and he does not give any kind of a direction to the patient. His verbal responses are very much minimal. He only gives a brief, explanation, and also he is non-commental, doesn't comment on the patient because it may interfere with the free association. So that is why the analyst or the psychotherapist is termed as the shadow person. However, he departs from this kind of a response once he has completed the interpretation of the particular patient's problem. So he becomes more communicative after the therapy session has completed. So that is the overall process of the therapy. Moving on to the techniques of the psychoanalytical therapy. So we have the major techniques, two major techniques apart from the other techniques. The one is the free association. The second one we have got the dream analysis. Apart from these two techniques, we have got the other techniques like abreaction, catharsis, and also hypnosis. Let us see each of the techniques in detail. The first technique is the free association. So what happens in the free association, as the name says, free. Here the patient is free to express whatever he wants to express, right? Whatever he has, maybe his thoughts, feelings, emotions, whatever is there in the mind, he is free to express it or ventilate it freely. No matter how disorganized the matter is, or no matter how trivial the matter is, even as minute or very simple problem or an issue the patient has, he is free to explain or is free to vent it out. So that is what is happening in the free association. Say for example, here the therapist gives certain themes, okay. Say for example, the therapist may say a word mother or a word blue. So here the client is expected to give the explanation which is related to the mother or to the color blue. Say the patient may say mother, as he may give an association or a free association with the word mother as being kind or love, or at times he may have a negative response towards the word mother, or say by saying being harsh or being very unaffectionate. So this theme, whatever the patient will give, it gives an idea to the therapist to interpret the patient's feelings or the behavior. Or say for example, the color blue, right? So when the therapist says the color blue, the patient may give a response as being very sad. So this is another theme what the therapist has got, right? By saying the word sad, the patient has given a theme or a clue that is something which is not right with the patient. So at the end, the therapist will interpret, okay, whatever the patient had, ventilated or expressed based on the keywords what the therapist had given. He will do the interpretation and he will help out the patient to resolve the unconscious conflicts. So we can see the overall purpose of the free association is it's going to help the patient to have a connection with the pattern of the thoughts and his behavior. It is going to help him to resolve the unconscious conflicts which he had in the early stages of the development in his life. So that is about the free association. Moving on to the next technique, which is the dream analysis. So, as the name says, dream analysis, you're going to analyze the dream of the client, right? So, here the client is expected to explain about his dream. The therapist is going to interpret, analyze his dream, and give the interpretation. Dreams are nothing but the repressed material which is there in the unconscious level of the mind. Maybe it is related to a desire or a problem or a troublesome matter. All these things are repressed in the unconscious level of the mind, may come as a dream. So here the patient is asked to explain about his dream in detail. So these dreams are interpreted to provide insight into the patient's problems or the issues, right? So here you're making the patient to become aware about his motivations or his dream so that he can express it out. So that was about the dream analysis. Moving on to the next technique, which is the hypnosis. What is hypnosis? It is an artificially induced state wherein the person or the client is relaxed and is usually suggestible. So, in the hypnosis, what we are doing is you're going to make the client to be relaxed, and then you're going to give some suggestions to the client based on which the client will respond. In the hypnosis therapy, the relaxation is guided by a trained therapist, okay, who is going to use various kinds of vocal stimulus, wherein he is going to verbally say that, continuously say that he is in a relaxed state, or he is made to view a particular image, or he is guided with a guided imagery, and it goes on to the relaxed state. So later on, the patient is made or is suggested to express his thoughts or his feelings. So through this therapy, whatever the unconscious conflicts or motives the person had, he will be able to vent it out. So that is a kind of a therapy to the patient wherein he will become aware about his conflicts. Okay, so that is the hypnosis. The next technique we have is the catharsis. So, what is this catharsis? It is the act of purging or purification or elimination of complex by bringing to the conscious level of the mind of a person. So, whatever the problems or unresolved conflicts the patient stored in the unconscious level, through the catharsis, he is going to eliminate those by bringing those to the conscious level of the mind. The last technique that we have in the psychoanalysis is the abreaction therapy or the abreaction technique. It is the process by which the repressed material, especially the painful experiences of the person, is brought to the conscious level of the mind. So here also, especially the experiences related to the painful events which had happened in the life of the person, which he had repressed in the unconscious level of the mind, will be brought to the conscious level, okay, through the process of abreaction. So usually here in the process of abreaction, it can be done by using a medication or without using the medication. So usually the medication used here to relax the patient, to sedate the patient, is thiopentone sodium 500 mg, which is dissolved in 10 cc of normal saline, which is given over a slow rate, okay, to prevent the respiratory depression. So through this is going to give a reaction or expresses emotions, out. So sometimes the expression of emotions may be to such an extent that he may cry or he may laugh or he may become very angry or aggressive. So to control all these feelings, we have got the therapist who's going to manage. So this is about the up-reaction therapy. The techniques that we have here is the free association, dream analysis, catharsis, hypnosis, and the up-reaction. So moving on to the indications of psychoanalytical therapy. This therapy is used in many of the neurotic conditions. Okay, let us see the indications. Number one, in case of the anxiety, in case of panic disorders, post-traumatic stress disorder, personality disorders, especially the borderline personality disorders, the psychosomatic disorders, the disorders which are related to the stress as well as the physical ailments. If the person is having persistent feeling of loneliness and also isolation, prolonged sadness, and in also sexual dysfunction. So these are the indications of the psychoanalytical therapy. So moving on to the criticisms of psychoanalytical therapy, even though this psychoanalytical therapy is very much useful to find out the unresolved conflict, to solve them up, it has got some limitations. So what are those? Number one is the patient must be highly motivated and articulated, right? So if the patient is not motivated, the self motivation is lacking in a person, then he may not be motivated to express his thoughts, his feelings, or whatever he wanted to express, his ideas, his trivial matters which were stored in the unconscious mind. So if the client is lacking the motivation, or if the client is not able to articulate, to communicate whatever he wanted to express, so then it is going to be a big failure. The second thing is it is very expensive, right? Since this session is a one-to-one session, it takes a lot of time, maybe in a week, 5 to 6 times the patient may have to undergo the psychoanalytical therapy. At times it may become an expensive thing from the patient and he may discontinue the therapy. So another major problem is it is very much time consuming. Yes, it is not a one-time procedure or a one-time therapy. It requires a lot of sessions, many sessions, and the person may not be able to give all his time and all his money into this particular psychoanalytical therapy. So these are some of the criticisms or the disadvantages of the psychoanalytical therapy. So overall, the psychoanalytical therapy is otherwise called as the insight therapy, wherein you're going to bring about an insight or awareness in the patient about the unresolved or conflict which is stored in the unconscious level, which is brought to the conscious level of the mind, to the awareness of the patient, so that his problems will be solved and he can lead his life in an effective way. So hope you all have understood the topic. Thank you.